Hi everybody. So on this video, I wanted to talk about what I look for, the 3 things I look for at the very beginning of a new patient interaction. So there's many things, and I have a very different interaction than most practitioners because I like to really sit with the patient, tap into their energy field, so I'm feeling into the patient. So if I say 3 things I look for, one of the things is not really a look, it's more of a feel. So I like to sit, kind of introduce myself, tell a little bit about the vision of the practice, tell a little bit about my story. And while I'm doing that, I'm just feeling, is the patient anxious? Is the patient aware or distracted? Are they checking their phone? Do they seem like kind of fidgety? Those types of things. Do they feel closed off? Very often, and I kind of enjoy it, I view it as a challenge if a patient is a little bit more reserved, and I respect it because many people have already done this game with traditional medicine where they've gone in with high hopes, high expectations, only to get shut down or criticized or gaslit that nothing's wrong with them. So it's pretty normal for a patient to come in relatively reserved. So that would be one thing, is I feel into where they're starting and understand that you can do this with people you interact with. Instead of just reacting really quickly, whether it's a friend, a boss, a partner, maybe just take a minute, sit in the field, and just kind of honor where they're coming from, because that's going to make a big difference on potentially how you choose to react. If you know they're reserved, diving in aggressively is probably not going to have a great outcome. Maybe you first respect them, let them share their needs or their concerns or their prior kind of experiences. That would be the first thing. The next thing that I look at is a patient's list of medications. So many people, especially on the traditional medicine trajectory, are put on a medicine for whether it's a disease diagnosis or a symptom, and then it never gets stopped. So we see it, they may move or they may go see a different practitioner, and those doctors, the new people that come in, are too scared to stop or change whatever regimen the patient was on before. So I've never had an issue with playing with people's meds. Sometimes it has been an issue, like I'll try to get people off blood pressure meds and their blood pressure may spike like crazy. So it has to be done very cautiously. I will say I wouldn't do this on your own. So speaking of like how this can pertain to you in your life, what I would say in that regard is if you are someone on a lot of medication for whatever reason, get a good practitioner who's willing to work with you at taking a look at alternatives, whether natural alternatives, or maybe they're just a medicine that got put on that's not really doing anything. I see that a lot. So I'll just wean very slowly and then make the decision as the dose is coming down, as we see what the symptoms are, as to whether or not we can stop it, whether or not maybe an alternate dosing is appropriate. And then another point I'll make about medicine for you guys is that if you are on medication, and if you're going to be on medication, whether it's thyroid meds or something for your blood sugar, your blood pressure, sitting, or even an antidepressant, while I do prefer alternative therapies, sometimes medications can be life-saving. And I don't mean that just in the traditional medicine sense. I mean, if one of my patients is so depressed that they're not able to function, if I can get them stabilized for a short period of time, sometimes needing that drug so that they can be stable enough that I can go help them fix their gut, that I can wean off their other meds, that I can have them be successful in therapy or self-care or meditating and journaling, and then we can wean the medicine. That can be a very valuable tool. So if you or your loved one is on meds and you've ruled out what you need to, what you can get off of, my advice there would be connect with the medicines. I talk about this a lot. Everything is energy. Medications hold an energy. If you can just talk to the medicine before you take it, connect. hey, thank you to whoever made you. Please come in my body, go through, do what you need to do without causing a problem, and then go. And that connection of gratitude, of appreciation for the benefits of the medicine instead of, oh my God, I can't believe I have to take this, that will do wonders for you. So I hope that one helps. And then probably the third thing that I do when I see a new patient is I let them know that in my history, which I take a very detailed history, that I'm not going to just be like typical practitioners, like when did you have this illness, when did you start on this medicine, when was your last blood work. While I do collect all that information, I also frame my visit by saying, I'm going to ask you some personal questions if it's okay, always honoring the patient and their free will and their energy field. So I always ask permission because I am really looking at where spiritual causes of illness could be playing a bigger role. So where did you get triggered? Where was there trauma in your life? How was your childhood? So if somebody was raised in an unstable environment, which is honestly a lot of people, it doesn't mean it's like massive abuse, but maybe it was two working parents that weren't really present because they were trying to make ends meet. Maybe it was somebody who had to move around a lot. Maybe it was an alcoholic parent. Those types of environments, what I see is a never fully formed adrenal gland that gives them energy because they're always living in survival, and that loop not only burns through the stress hormones, but it also will just burn through energy. So they don't have that core. So they're coming in with looping survival trauma and not a good basis of energetic support. So in that type of scenario, and then as I move forward to wherever they are in their life today, where else were there triggers or traumas, and what do we need to do to get you out of that cycle that actually might still be going on? So if you're somebody who did have an unstable home environment, it is very, very common. You may feel like you've done a lot of therapy or you've worked through it or you're in a safe place now and you've made amends with your parents or whatever happened back then. But your body may not have gotten the message. So if your body didn't get the message and it's looping, we need to coax it back into safety, and there are ways to do that. So I hope these little tips helped, just so you can see some of the things I look at that are a little more unique and how maybe you can look at them in yourself and in those you love.